Hello, namaste. A warm welcome to everyone. As you've seen the title of the show, Significance of Geriatric Care. Now, one might wonder what is geriatric care and what is the significance. Of course, we're going to learn about all this, the care, what is that term means, and what significance it has in our country and our society. And to speak on that, who else could we have but an expert in geriatric care, not only in learning but training? And her name is Professor Nasreen Rustomfram. Professor Nasreen Rustomfram did her PhD in management of human service organizations from the prestigious Tata Institute of Social Sciences, Mumbai. And that is where she joined in 1985 for a career in teaching. Professor Rustomfram headed as a chairperson of the Center for Lifelong Learning. That itself is very fascinating. I love that term, lifelong learning, because I think all of us should be learning lifelong. So we have such a wonderful personality with us. Even now, even after a superannuation in February 2020, she was given an extension, so she's still a professor at the Center for Lifelong Learning at TISS. So let me invite Professor Nasreen Rustomfram on our show. Welcome, madam.
Thank you, Mr. Mokashi. Namaste to everybody. I'm very happy to be here to speak upon this important topic, the significance of geriatric care.
Now that you have also said that it is a very important topic and our viewers also want to know what exactly do we mean by geriatric care. So could you briefly tell us what exactly does it mean? Is it something new or did it exist for a long period of time?
Well, not a very long period of time, but definitely for the last about 100 years, the term geriatrics has been known and understood. First of all, we should differentiate between the term geriatrics and the term gerontology. So, geriatrics means the care of the aged, whereas gerontology is the study of the aging process itself. Sometimes geriatrics is also known as medical gerontology.
Then, madam, the question that would arise is that for centuries, human beings have been taking care of their old. So, how different is geriatric care? Is it only the terminology, or did we learn some new aspects of that?
Well, the family has been considered the ultimate and the safest refuge for the elderly for centuries. However, our social and environmental conditions have rapidly changed in the last century. In 1989, Alfred Savy said that the 21st century will be his century of the aging of mankind. And what he really meant by that, uh, very succinctly, we can elaborate by understanding the social and demographic changes that have taken place. With specific reference to our country, the life expectancy has increased in the last 20 years by 20 years. From the census of 91 to today, we expect that the average Indian citizen would be living up to the age of 75 or so at least. And it is interesting, here I would like to point out that women are expected to live longer than men. So there is also the concept of feminization of aging. And this is for two reasons. One is biological, and the other is that in generally in a marriage, it is women are younger than men generally in our society, and so they also tend to live longer than men, their spouses and partners.
So, as you have explained, madam, that geriatric is something to do with aging and old elderly people. So, what different care do we have to take when we say geriatric care?
Well, uh, there is a very large spectrum of caregiving. One way in which we can look at it is what is the location of caregiving? Where does it take place? So, caregiving can take place in the family. Caregiving can take place in institutions such as hospitals and old age care homes. And the training that we give caregivers has to reflect or develop their capability in developing skills for both the sectors. Home caregiving, which is also sometimes referred to as unpaid caregiving, and also institutional caregiving, which can often be a paid service performed by the person.
Now that's a wonderful point. I noticed. It didn't it didn't strike me ever that this could be. You need to be trained in this kind of care, because why the question comes up is I've seen a large number of old age homes mushrooming in different parts of the country. I know that they really want to give service to the old and the elderly, but one also find that the proper care is not being taken, or they seem to be wanting. So, how do we need to train them, or is it required at all to train them?
Well, Mr. Mokashi, uh, I in response to your question, I would first of all like to point out that in the Indian culture, welfare of the elderly has been one of the paths to one's spiritual journey. So, care of the elderly is something that many, say, royal families, well to do families, they considered it one of their spiritual duties to establish old age care homes. And it was well known that vulnerability in old age, required care and required someone to specifically look after them. Having said this, I would like to say that since life expectancy has increased, people are living to longer, and also there are dual career families. So, women who were generally the unpaid caregivers at home also now have to look after the home as well as the job front. All these factors, and of course there's migration. Migration in our country, one is from the rural areas to the urban. So there are a lot of elderly people in the rural areas who don't have young people to look after them. And then there is also the international migration, that is from the country outside to foreign countries where children have gone and settled. And in all these situations today, there is a great demand for caregivers, and specific training is required for caregivers, whether they are unpaid family caregivers or whether they are paid caregivers in the institutional setting or in the home setting, because the care receiver not only has medical needs. Generally, when we think of geriatric care and elderly care, the first thing that occurs to us is that there would be healthcare medical needs. But apart from that, it has long since been realized that social, emotional, and psychological needs of the care receiver are as important as their healthcare needs. And hence, the training not only needs to be with regard to the health, but also with regard to social and psychological and emotional support to the person, to the elderly person.
Professor Rustam Farham, it's such a always a pleasure to talk to a teacher, a professor, because you read my mind probably. And there was a question that came up, and I'm sure you know how what questions would come in the minds of the mentees. That is this care training meant only for the medical staff? So you did mention in passing it's not just medical. Would it be possible for you to elaborate a bit on non-medical care and the training required for that?
Well, so now when we talk of the non-medical needs, let me say that the non-medical needs exist for both the caregiver as well as the care receiver. The care receiver's needs have probably been diagnosed by a doctor or by a team of specialists who may have said that the nutrition of the elderly person, or physiotherapy, or mental health needs, several of these aspects have to be looked after. uh, the training that a caregiver would receive would require it to be holistic. So, in that sense, what we would say is that caregivers are equipped to understand the social and emotional needs of the elderly person. Social needs would mean the needs for recreation, the need for interacting, with people from other generation and intergenerational interactions. All of these would come under the category of social needs. Psychological and emotional needs would involve the caregiver understanding the state of mind that the elderly person is at that point feeling. For example, a person with stroke may be in depression or deep depression. A person with diabetes may be experiencing swings in moods, and because when they are hypoglycemic, etc., then they would undergo some amount of uh, the sugar lowering, and this would also affect their moods. And these are some things specific to diseases also that caregivers need to understand emotionally, the emotional needs, and they also need to be able to cater to these and look after these.
In our
But I
society,
also mentioned at the
yeah.
beginning of my response that caregivers have also have emotional needs. One of the most important things is that sometimes um, uh, deterioration in elderly patients may come all of a sudden. They may not come with any advance warning, and the caregiver may be taken aback, may become irritable, may become anxious, fearful, may also experience emotions of their own because they have not been mentally prepared to see such a deterioration in their near and dear one. And they may be sort of taken aback as to how to cope with this situation. So, caregivers also have their own emotional and psychological needs.
So, given the background that you've given us about this geriatric care, how significant will it be in India that we train people for such care?
Well, uh, let me emphasize that caregiving for the elderly is an extremely culture specific uh, area. The training that caregivers to Indian elderly would require would differ from the training that would be given to caregivers in, say, Japan or any Western country. Um, It is well known, for example, that the Japanese prefer to have caregivers from the Philippines because um, their features resemble the Japanese more closely than, say, a caregiver from South Asia. Now, why would the Japanese think of this? It's because elderly Japanese would feel more comfortable with people who look like or look as close to them as possible. Why,
Mhm.
in fact, does Japan have to look at Philippines or South Asia or Thailand or anywhere for caregivers? That is because Japan is the country with the highest number of elderly in the world, in proportion to the population, and so there are less people available to take on this task. It definitely is not so in India. We are a population excess country, and we have a large number of, say, a population who could be devoted to this particular profession.
What role has TISS been playing in geriatric care and its training?
Um, Tata Institute of Social Sciences, their flagship program has been the post graduation in social work. When the Center for Lifelong Learning saw that there was a niche area in working with the elderly that had not been covered so far, in 2007, we decided to institute a training program, and we thought that it would be most attractive to those who are already working in NGOs catering to uh, the elderly. Uh, we developed a curriculum, a diploma in gerontology. So it was not geriatric care that we began with, but we began with the study of gerontology, the aging process itself, because social sciences has been our forte. However, while sort of after about 3 or 4 batches of the diplomas in gerontology, students had completed their training, we found that there was a great demand specifically for geriatric care because health needs seemed to be predominant along with many others. And this was not only physical health, but also mental health. Hence, we decided to take up developing a program, a certificate course in geriatric caregiving itself. So, we run both the programs, the diploma in gerontology as well as a certificate in geriatric caregiving. And we decided that we needed to reach out, that just having 20 or 30 students per batch coming to the institute would not be sufficient for the kind of manpower that was required for this work. And so we decided that we would reach out to NGOs and offer this program, the certificate in geriatric care, in collaboration with these NGOs. And that is how we began. And our first course came across in 2013.
So, Professor Rustomfram, what would be the duration of this course?
This course is, if you do it full time, we have kept it flexible because we think that there might be those who may wish to do it only part time. And if you do it full time, it could be completed in 15 weeks, which is one semester according to the university system. However, if you don't do it full time, that is 6 hours a day, then it would take longer to complete. Altogether, the course has 420 hours of classroom study and field practice. 420 hours.
There is practical work also
Yes.
in the course. That's very interesting. Now, another question that arises, that a lot of these caregivers are from smaller towns, or they are not really English speaking. Is this course available also in Indian languages,
Well,
or is that a
yes.
plan?
Well, I'm very glad you asked that question because actually there is no certificate program in geriatric care that has been run in English. All the programs have been run in the regional language with the collaborators where they have been offered. So we have run this program from Aurangabad, Palghar, Bharuch, Chennai, and so in Chennai it has been offered in Tamil, and in Palghar and Aurangabad it has been offered in Marathi, and in Bharuch it has been offered in Gujarati. So
Oh,
the organizations whom we collaborate with have this responsibility to deliver it in the local language only, because these are students who have completed their 10th standard, and so English is not their forte. And that is not the only reason. The elderly people who they are looking after are also not very well versed in English. They would also like to be conversed with the elderly in their own mother tongue. And so the course is conducted in the mother tongue and in the regional language of the state where it is undertaken.
oh, this is such wonderful information. And I think it's not very surprising either, because the TISS is known for reaching out to people, understanding the social issues, and then devising courses accordingly. So I think that was a wonderful thing done by the Tata Institute of Social Sciences to have the training in Indian languages primarily. Now,
Thank
another question that comes up, madam, what you've been talking about, the significance and the need, and what's going to happen in the country in the next 20 years, how the population of the elderly is going to increase. A question that comes up, and I mentioned in the beginning that lots of these old age homes are mushrooming. Do you think it is legally required now, or it should be made legal that people giving such care should be trained or they should be certified?
Uh, this is $1 million question, and I'm very glad to be able to address it in this particular interview. Uh, Caregiving for the elderly has been seen as a welfare or a charitable activity. It is time now that we see it as a professional activity which has certain standards of delivery. So it is not just by common sense or sympathy that one needs to look after the elderly. There also needs to be science in this particular caregiving, and this will come through training. So training will also set certain standards for those who graduate or pass out of these courses. On the other hand, old age care homes also require a certain standard or a benchmark for service delivery. Uh, Sometimes one finds overcrowded old age care homes. Sometimes one finds the standards of hygiene and those who are delivering the service below par. And often it has been considered that something is better than nothing. However, this phrase is completely inappropriate to old age caregiving. We cannot just assuage our conscience by saying something is better than nothing. Whatever is delivered has to be of a very high quality, a good standard, and such that it is taking care of the elderly person physically and mentally, both.
So, have these standards been uh, framed or have they been submitted to the government?
The National Institute of Social Defense has held several um, conferences in which there has been discussion and recommendations to the government and what are the minimum standards that need to be followed for old age care homes. The National Institute of Social Defense is an autonomous body under the Ministry of Social Justice and Empowerment, and they are also in charge of disbursing funds for elderly care and for old age care homes on behalf of the Government of India. HelpAge India is also a very large NGO which has worked to evolve appropriate standards for old age homes. And all these recommendations have been placed before the government. Unfortunately, they have been discussed on and off, but they have not yet become the law of the land. No bill has been passed, and so there are many institutions who continue to offer substandard services. And because there is such a dearth of old age care homes and services, many of these institutions, many people continue to use these institutions uh, for lack of an alternative. There isn't anything else.
That's where the law comes in. But you mentioned in your previous sentence that there's a dearth of such caregivers or centers. So, which means in the present situation, a lot of people are looking out for employment. Are there good employment prospects for people who are trained in such care?
Uh, I think the prospects are good. Salaries in a urban area can begin from as low as 600 rupees for an 8 hour shift, even in home care, all the way to about say 30,000 rupees a month. There are several families uh, from an upper economic background who are actually willing to pay for good services. They are often, worried and anxious about their elderly people whom they leave behind at home. And so are, for example, NRI families who would like to give the best to their parents, elderly parents who are residing in India, but they are willing to pay, but they often do not find the quality of person who can do this task. But as with everything else, Mr. Mokashi, India is a country with two divides. While there are people who can afford to pay 30,000 a month for care of their elderly parents, there are extremely poor people who actually don't have any resources for anybody to be able to look after their elderly. And here it is that NGOs will have to develop staff or manpower who can be sent out to very poor homes. And here they can become home caregivers, visiting elderly in their homes to check on them and to see that they are having their medicines on time, that their diet is being done properly, and that they are also not being subjected to any elder abuse. I think when you hear the term elder abuse, you will be extremely surprised and wonder as to who would abuse their elderly. But unfortunately, there is a lot of elder abuse. Everything from being denied food and medicine to being denied actually even basic income, basic care, visits to the medical facilities. All of these are very often neglected and come under the category of elder abuse. So, home care workers, elderly home care workers who will visit the homes will also be able to keep a track on how elderly are being treated in their own home and whether they are receiving adequate care.
So it's quite a contradiction in our society. On one hand, as you mentioned, we look at geriatric care at home or taking care of our elderly as a spiritual duty. But at the same time, yes, I fully agree with you when you said that there is elderly abuse. We have seen that on the television on a few occasions, and how they have also been beaten up. It's very sad to see anybody being treated like this. So
Indeed.
before we end our talk, before we end our interview, Professor Rustomfram, what would you tell the potential caregivers or people who would like to uh, do service to the elderly? What message would you give them?
To those who would like to get themselves trained as caregivers, professional caregivers, I would ask them to look at both aspects. I do understand that bread and butter is important. We do understand in geriatric caregiving that those who work will be looking at this as a source of income, but we also request them to think in terms of this as something which will require humanity, something which will require empathy. That merely looking at this as a source of income, uh, this will not have, such people will not have an aptitude for care. So when we think of uh, an elderly person, how would we sort of uh, empathize with them? How would we be non judgmental about some of the decisions that they have taken or made in their life? How would we be able to look at them as people who can still take their own decision? Because one of the main concerns with mental health of the elderly is their ability to feel in control, their ability to feel that they are still empowered and that they are still in charge of their life. And this is so for any adult actually. At any point in life, when we feel that somebody else has taken control of our life and is making the decisions for us, it leads to a lot of anxiety and fear, and it leads to a feeling of helplessness. Uh, and we know that when mental health suffers, it is then that physical health also suffers. So, a lot of mental health issues, feeling helpless, feeling depressed, or lonely, are the precursors to diseases such as diabetes, hypertension, anxiety, and so on. So, I would really suggest that caregivers enter this profession thinking in terms of how, while they are going to earn an income, they are also going to do a very significant service to mankind and to the people whom they are going to look after. And here, at the end, I would like to emphasize that a sense of humor is a wonderful quality for a caregiver to have. Humor leads you, in fact, to improved mental health, and music, humor, and cultural aptitude. These are three of the qualities that all caregivers should aspire to and cultivate.
Professor Rustomfram, it was such a pleasure listening to you, and one would like to go on, but there are always constraints of time. And I must also confess that some of your examples or what you mentioned, your sentences, very overwhelming for me. And your appeal, of course, was so fantastic. Um, I wish I'm now very close to not too close, but a little close to the being in that category of being cared for in the elderly. Others, I would have loved to be part of your
We are all
training and
headed. We are all
yeah, but
headed there.
no, but what I'm trying to say, the way you put it, it is so tempting that, oh, I wish I could have done this kind of a course or such training. It was really overwhelming. I thank you on behalf of the TISS, for finding time from your busy schedule for this wonderful interview. And I am sure our viewers will gain as much as I did. Thank you so much, Professor Rustam Faram. It was a pleasure talking to you.
Thank you for inviting me for this interview. And it is a subject I'm passionate about, and it gave me great pleasure to be here today and to talk with you. Thank you so much.
Okay, goodbye.
Goodbye. Namaste.